Welcome to the Santa Clara San Jose League of Women Voters Insights and Perspectives program. I'm Ann Clark from the League, and this evening we're focusing on Santa Clara County's healthcare system and the implementation of the Affordable Care Act here in our county. I'm pleased to have with me a person who is an expert and in a lead position in the county in what I think of as the get ready, get set, go of what we call ObamaCare. This is Rene Santiago. He's a deputy county executive for Santa Clara County and the director of the Santa Clara Valley Health and Hospital System. Yes. Rene, thank you so much for being here at a time when healthcare truly is in the front of our news.
Thank you, Ann, and thank you for the invitations. I'm glad to be here.
Now, your title is quite a mouthful.
Sure.
So perhaps you could start by telling us a bit about the Santa Clara Valley Health and Hospital System.
Yes, and I'll be happy to. We're the second largest public health care system in the state of California. We live in a county that's been long-term and is traditionally, historically, very committed to having a very strong safety net. So most people know us by Valley Medical Center, for example, the big level 1 trauma hospital that we have in the county, but we also have our public health department, we have our mental health department, our substance abuse and alcohol services programs. So we do a variety of things. This is something that our County Board of Supervisors has long traditionally supported very extensively. Plus, we've been one of the leading counties, in fact, to make a very early commitment to enrolling as many of the population as possible. In fact, we're the first county that had what we call our Healthy Kids Initiative. It was the first county in the whole U.S. and the whole nation to actually commit to enrolling every child, regardless of their income status, into an insurance program. And so we've long had a strong commitment from this community for having healthcare access and extensive coverage.
So it sounds like this system must touch some enormous number of Santa Clara County residents already.
Yes, and we're, as you know, as a public health department, we're responsible for the health of all 2 million people. Wow. But we also have very specific programs for some of the most vulnerable populations in our community. So we have a Valley Homeless Healthcare Program that goes out into the encampments, and some of it are physicians that go and give checkups, follow up on their care. We have public health nurses going into the homes of residents. We have clinics very extensively. Plus, we have contracts with a lot of our community-based clinics and community-based organizations to do a variety of things, all of us striving to improve the health of the population.
Wow, so better health for all of us.
Yes.
Through what you're doing. Now, you're a relative newcomer, I understand, to the county. Tell us a little bit about how you got here. The responsibilities sound awesome.
Yes, it is. You know, it's a large, complex system. So we have about 6,000 employees and a variety of different programs, as I indicated. And I came up. I started in February of 2012. I was previously in San Diego for 10 years, doing the Health and Human Services there as a general manager. And prior to that, I was in LA County. So I've been in county government now for more than 15 years as part of my service. And I'm a strong believer in the public service, given the historic nature of the Affordable Care Act, which is National Health Reform, more commonly known as ObamaCare. I thought it would be a great opportunity to be in a community that has this kind of tradition, long-term support, commitment, resources devoted to it, to have something of not just a promise of health, but a real experience of delivering on that promise down to the individual level. So we've been doing a lot of work over the last few years to get ready for this moment. We've had a lot of challenges. We've had a lot of, even as extensive program and services and health system that we have here, sometimes it's a little bit more complicated to do some of the fundamental changes that you need to do. But I tell you, it's been incredibly fascinating, as well as it's been an incredible experience positively to be here in a community that supports it, that understands it, and that are really looking to have a successful experience from healthcare reform.
Wow, and it gives us a lot to be proud of, or at least a base to build on towards something to be really proud of.
No, absolutely, and as indicated, this county started enrolling kids long before that. Obviously, a lot of the healthcare reforms that are coming up, and there's a lot of focus on January 1st, but a lot of the health reforms already started in 2010. This county was one of the first counties to actually begin to expand coverage for the uninsured, mostly males, adult males, single males. We expanded what we call the Medicaid coverage expansion. It was under a special deal that was negotiated between the state of California and the federal government to advance some of these reforms. And we were one of the leading counties to actually start that in 2010. So we already have almost 18,000 people already enrolled, receiving coverage, even prior to January 1st. We have an incentive payment program for a hospital to change the way we deliver care and services to the community. So there's a variety of different programs that we already started on the ground, even before some of these landmark dates that are in front of the people's minds.
When you talk about system change, could you expand on that some? What does that mean? What would be different?
Well, and there's different levels. Obviously, on the care delivery, which normally involves hospitals and clinics and physicians, there's a lot of comprehensive changes happening in terms of not only the focus areas, but then also in terms of the reimbursement. It's generally known within the health industry as the triple aim, because in America, one of the recognitions of national health reform was that we're spending quite a lot of money in healthcare, and the quality is very uneven. Plus, we had these 40 million plus people uninsured. So it was really tragic proportions. It was almost, if you could recall the debate that was going on, it was the cost of doing nothing, which is, with rising cost, very uneven quality, and having a lot of people go without. So one of the things that we started is, as part of our hospital program in terms of the incentive plan, is to start expanding primary care. So we increase access for the population, so that, in fact, instead of waiting for the disease to get critical and ending up in the ED, that we provided points
ED
of access
is
in the emergency department.
Thanks.
Yeah, there's a lot of acronyms in healthcare. And so, as opposed to waiting for receiving care when it's most acute and serious, is to be able to get some of the early preventive primary care, basic primary care. So this county has invested quite a bit in that regard. In fact, we're working on a downtown health center that's getting built right now. It's going to be a state-of-the-art. Similarly to the way voters supported the expansion of the new bed building in our Valley Medical Center.
Right, I remember that being on our ballot.
Exactly. So there's been a lot of long-standing support for these reforms. It means also for providers, doctors, is as opposed to just working themselves in an office, is how do you actually get teams of people to actually take care of populations? Now, it may sound simple, but a lot of our care...
Doesn't sound simple to me, no.
Well, a lot of the care, as you know, is done one-to-one.
Right.
It's really the physician and the patient in terms of that encounter, dealing with whatever's in front of him. One of the things that, as part of healthcare reform under the triple aim, is to start shifting away from taking care of illness to actually managing the health of populations. So you actually begin to look at groups of people, and then working with teams to do whatever needs to be done so that you get the prevention on time. So you get the focus on wellness. So you begin to avoid some of the most costly episodes of care and the episodic care and the nature of the care that is very a burden to the health system. So those are some of the reforms that we're talking about. And then there was also, a real critique of our health system, because the National Institute of Health had done a study in the 1990s where a lot of people were actually dying in hospitals as a result of hospital, what they call hospital-acquired infections. And so there's been a whole drive and a whole push to focus on safety, on the safety of hospitals. We have a whole incentive plan related to that. And in fact, Valley Medical Center does very well on the safety and the quality of the care that we deliver. So we've been able to gain from some of the reimbursement incentives.
So you actually have done better.
We've done very well in that regard. Our safety and the quality scores are some of the best.
Even though I would assume, just given the economics, you're dealing with some of the sickest people in the county.
Yes, and that's always a challenge because we do, as an open system, what that means is we tend to take everyone, and in most cases, we take some of the most acute and severely complicated cases. We do this on behalf of the community. That's our mission. Is to be able to be an open system, to be able to provide care to everyone, regardless of their insurance status or their income status. So it creates challenges, obviously, in terms of when people are coming in, and how do you deal with the demand and the need, and how do you begin to triage, which is what we need to do in terms of taking care of the most critical. So we do have some of the challenges, for example, that we experience longer wait times in the emergency department. The biggest complaint we hear about our health system is, you're great once I get to your system to see the doctor, but boy, getting to your system is always a challenge. So access is a big issue for us, is what are the changes that we need to make in order to provide that access, to provide that timeliness that our people now are going to have a choice. Because one of the things that, obviously, in healthcare reform, one of the big priorities is expanding coverage. So people are going to have options now. They're no longer, just going to Valley Medical Center because of the last resort. They're going to be insured, they're going to have options, and we're going to have to compete, which we haven't traditionally done, for those, what we call lives. And so it's so important for us to have the whole patient care experience, to have the access, to go along with the safety and quality that we're known for.
Do you have a sense of numbers? I mean, when you look at, I don't know how many people in Santa Clara County are uninsured now, how many are likely to be entering the total system or your system particularly?
Yeah, and it's not a perfect science because it's a lot of estimates here, but in our population, we have about 1.8 million residents in our county of Santa Clara. We like to think of ourselves, we take care of all 2 million because there's about 200,000 visitors. So as public health, we see all 2 million. But I think the numbers, we do very well with kids. 97% of the kids already have some kind of coverage, either through our Healthy Kids or through their own private insurance. So the kids are generally, we still got a 3% to go, but we generally do a very good job as a community in covering kids. We still need to do, for the other remaining 3%. But it's really what we're talking about is really the individuals and families, mostly within the ages of 18 and 64. That's really where we're talking in terms of the estimates. It's estimated under healthcare reform in Santa Clara, there's going to be about 48,000 residents that will be qualifying for the Medi-Cal expansion. That is the low-income program that's going to be available for those that, for an individual, make a little bit less than $14,000 a year. For a family of four is like $25,000 a year. So for those folks, there's going to be Medi-Cal expansion. It's probably 48,000 that qualify for that piece. Then there's going to be another 80,000 that we're estimating that will be eligible for Cover California, which is the health exchange.
That's where I figured we'd go next.
Exactly, the health exchange a lot of people are talking about right now, which is the new marketplace that's getting established. In California, we're a state that's doing it ourselves. In other states, the federal exchange is doing it because the states did not exercise their option. So in Cover California, there's an estimated 80,000 that will qualify for some kind of a federal subsidy under that.
We're going to take a break for what amounts in this as our sort of our commercial, which is a fun fact. If we look, we can see what this question is, and it's a test for both of us as well as our audience as to whether we can answer it or not. So, fun fact. Okay, so I did actually know that, and I'm going to tell you a personal story, which is going to interrupt, because Samuel Chase was relative of my husband's, is
really?
one of our antecedents. So I had actually heard that story before.
Wow.
I
Interesting. That's something new for
Isn't
me.
that weird? So let's talk about this exchange, because that
Sure.
certainly is getting all of the press attention right now. California is running its own. It was available October 1st. How is it going?
Well, the exchanges are very critical. We consider the exchanges actually something that was impermeable to Supreme Court decisions or even congressional actions. This is something that it was bipartisan, that people felt that people needed a marketplace where they can go and find out what their options, what's affordable, what's available to them, and then be able to provide some tax subsidies for them. So in California, it's Cover California. It's already had its launch October 1st. Again, the benefits don't take effect until January 1st. So what people are experiencing or hearing about is what they call the experience of shopping, which is they go online.
Which is www.coveredca.com. Yes?
Exactly. It's very important to get it right because there's also some false sites out there. So it's important that you go to the right one. They normally ask you to enter some information about your household income, the number of people in your household, and then going through the calculator, they'll tell you what you potentially qualify for under this exchange. In many cases, people that already have individual insurance coverage, which is the initial piece, is individuals and small employers. That's the target. They're finding out that it's much cheaper for them. The estimates is that about for 70% of the population, they're going to find that it's more affordable than the traditional commercial insurance market. The other 30% are probably likely to pay a little bit more. And there's a
But
little
for better
controversy.
coverage is the...
But that's one of the benefits, that it's not only making the affordability available to people and be able to have options and know what's available there in your community, but then also to have a comprehensive set of benefits. And that's one of the tenets of healthcare reform, that it was for the first time in Americans' history, we had a standard set of comprehensive benefits that should be available for everyone. And I think people are going to have choices related to the levels of payment and subsidy. That's where you have the medals. There's the famous medals of
The
bronze,
platinum
the platinum, and all these things. We really encourage people to just go there and experience it, so that way you get a feel for it. And so all of the different plans will have a comprehensive set of benefits. So they're all going to be regulated on price and on benefits. So it kind of standardizes the comparability between one option versus the other. And most of it is going to be, the differences is going to be around the co-payments, the deductibles, and obviously the network, which hospital,
Do I have a
which provider participates in which plan.
So here, let's pretend, here am I have gotten to the www.coveredca.com and perhaps done this initial step of my income and whatever. What do I do then, and where are these problems coming that I read about?
Yes, and there were a lot of glitches, as you know, that has been reported. We knew something that's new, off the ground, of this level of significance, because it's amazing. 7 different presidents have tried to get national health reform in America. And so this is something that, it's been battled for a long time. A lot of blood, sweat, and tears has gone to get us to this point. So it's very historic. And now we're dealing with technology, which in the past we didn't have. And so in many cases, there are glitches. What California did well is that you can have that experience, the shopping experience, without creating your account. Because it's almost like a 2-step process. You go there, you enter some basic information about your household income and et cetera, and then it gives you what subsidies, what different plans are available. And then if you're really interested and want to get to the buying decision, then you have to set up an account. And then when you set up an account, then it asks you for very more specific information. And then there's been questions, okay, can I really see who participates in what plan? You have to go through that 2-step process in order to get to that point. Some of the controversy of the federal exchanges is they didn't do that. in the federal exchanges, they actually asked you to set up an account on the front end. So a lot of people have had a lot of problems. The whole system wasn't available, there was crashes, et cetera, et cetera. So they're changing some of the setup in the design. But what we're letting people know is go get the experience. You still have until December 15th to submit an application. And then December 15th, you have to make your payments. You still have 10 days from there by the 25th to make the payment so that you can start getting the benefit January 1st. There's going to be an enrollment period between October 1st all the way until the end of March, where people are actually going to be able to not only have the shopping experience, but then also make their decision about which plan without facing the penalty that's been talked about. The initial, if you fail to do that, in terms of as part of getting coverage, there is a $95 or a percentage of your, I think at 1% of your income, that if you fail to do that, you're going to have to pay as part of your IRS, submission of your tax forms. That's so important. That penalty begins to increase in the subsequent years.
Okay.
So, what we're trying to let people know is be informed about it, have the experience, don't rush in because there's a lot of other activity going on that people are trying to put the pressure, sales tactics on some of these folks. Get the experience. If you're still having difficulty, there's going to be a lot of community-based organizations available in our county that we're working with to be certified enrollees for Cover California.
Is that, I've heard about navigators and assisters. Is that?
Cover California is going through the process of training a lot of people. We're actually becoming one. Our Valley Medical Center is becoming a certified enrollee entity where people that come to our facilities will be able to screen them, take applications, and then be able to get them enrolled. There's going to be more than 20 different community-based organizations that are going through that process right now. We have to go through trainings. It's got to be standardized. There's the famous background checks. There was a political debate about how do you going to volunteer information, and if you're not verifying that it's not going to be used for criminal purposes. So there's a lot of controls built into the process so that in fact the information is used appropriately. So we have to go through training.
But that is how I can talk to a human being. Let's say I find this website totally confusing or whatever.
There's going to be two other ways. One of them is with the phone. So you pick up the phone and you can call, and we have those numbers available. And we also have the face-to-face to go to the certified enrollees and be able to get the personal assistance.
So that could be where a community clinic, that could be if I was coming to Valley, any of your services, that would be, okay.
And our social services agency. Our social services agency that has various locations throughout our county will be able to take applications for not just Medi-Cal, which they do right now, but then also for Cover California. Because remember, the two significant changes happening in January 1st is that more people are going to be qualifying for Medi-Cal, because we live in a state that is exercising the expansion of Medi-Cal.
Right.
And then the second piece is going to be this Cover California exchange.
Okay. And the phone number is 800-300-1506.
Correct.
And I read somewhere that's available from 8 a.m. to 8 p.m. Monday to Saturday.
Correct. And so people will have, you could go online for those of you that feel very comfortable to do that. You could call, use the telephone, or you actually could go to one of these community-based sites or the county departments on the health or the social services to get the necessary personal help to get you enrolled.
Okay.
And again, you have until December 15th if you want to get the benefits effective January 1st.
And I gather, since it says the exchange stays open till March 15th, I think it is. Right. So does that mean there's some leeway in terms of when I'm going to be penalized if I don't get this done?
Yes, it's until March 31st, except obviously you have to apply by the 15th of the month. So March 15th, you have to apply in order to start getting the benefits the following month. And so in order to avoid the penalty, during this open enrollment period, you have to be enrolled.
And it certainly sounds like it would be a prudent thing to get started.
Absolutely. We encourage, because you mentioned about our Better Health for All. At the end of the day, yes, it's good to get coverage, and yes, it's good to be able to have access, but that's supposed to be better health. And so our focus as a health and hospital system, through the leadership of our Board of Supervisors and obviously Dr. Smith, who's our Chief Executive Officer, has been that to be truly successful, we want people to improve their health. So we're doing all these things. We definitely want people to be covered. We definitely want people to have access to care. But ultimately, the true success for us is that people actually gain better health. And that gain better health in Santa Clara County is for all our residents. We have programs available. So even if you don't qualify for Medi-Cal, you don't qualify for Cover California, we still want to take care of you so that in fact you improve in your health and your family's health.
And actually I even know within my own family of a success story of enrolling a young adult before the ObamaCare changes happened, where he was getting care at Valley and a very kind person helped us walk through the process.
Yes.
So that he has some insurance coverage at least.
Yeah, exactly. And that's what this county's been about, quite honestly. This is the exciting opportunity that all of a sudden we're expanding all these opportunities to all residents. We anticipate, again, to be close to universal coverage. Some of the states that are successful, like Massachusetts, they already had Mass Health, and so they're at 95% or above in terms of coverage for the whole population. That's really what we're aiming for. Obviously, we have a different dynamic in California.
Right.
We have undocumented within our communities that are not going to qualify. We have some permanent residents that are under 5 years that may not necessarily qualify for some of these programs. But we really want to encourage people to go through the process, find out exactly what your situation is. We have many families that are mixed. So in some cases, the children do qualify, but the adults may not qualify. And so we were asking people to go through the process, get experience, get the help, and get covered so that you can improve your health.
And that's a great message for us to end on. Thank you very much. I think that I also want to say that if any of you are interested in further information about the League of Women Voters, to make a comment or ask a question, our website is lwvsjsc.org, and we've also had the information available for those of you who need to access Covered California. Thank you very much for being here.
It's been a pleasure.
Thank you.
Thank you very much, Anne.